So we have a very exciting opportunity, I think, in this phase of medical history, and that is to reevaluate how we actually train our medical professionals. I think it's time to start true interdisciplinary education. I think there are things that we could best learn together. So there's the curriculum that we would explore together, and there's the secondary curriculum of actually learning it together. It's powerful. When I ask a young physician in training a question and the nurse practitioner in training says, well, have you thought about? They're learning teamwork at the very beginning. Now there are going to be things, I look at this like a tree. In fact, I have a big wooden tree in my education office. There's the trunk, the things we learn together, and there's the discipline-specific branches. And some things stay together, like nurse practitioners and physicians stay together for a good amount of time, and then there are discipline-specific aspects to their practice. But the more we start to teach team from ground zero, the better care is going to be in the future. What's very exciting as we strive to create continuum is that no one piece of the continuum, no one team, no hospital, no home care can do it alone. This is really, truly about collaboration. So I had the privilege of attending a Remington post-acute conference and listening to the people around the table who used to think of this home care or that home service as competition, is now a partner, because we've got to pool our resources. We've got to extend our footprint. We've got to collaborate. There's a lot of people who need care, who have fallen between the cracks, who haven't qualified, and now we have an opportunity to find each other and come together and really create robust continuum. So it's an exciting time for those who have worked, in a sense, feeling disconnected out in the community doing the good work, yet not feeling connected. And there's been true barriers to being connected. The lack of a cohesive, intertwined medical record is insane. The fact that our medical records don't talk to each other, the fact that some areas are still doing paper charts and others are not. Until we create that, it's really difficult to engage the teams. So that's got to be a big piece of this. But also those change makers, and I like to think of my team as true change makers, looking around and saying, who else needs to be involved in the care of this patient? Meals on Wheels. One exciting project, paramedics. So the paramedics are called out to a home to take somebody off the floor. It's been the third time Mr. Jones has fallen. They could do that and just walk away, or they could do that and they could notify the community health worker that Mr. Jones has fallen for the third time and his wife is under significant stress. Could we begin support? This is what I think is going to increasingly unfold, is this network of what true community consists of. So this massive open online course is an incredible opportunity to provide information. And my hope is practicing physicians, practicing nurse practitioners, really the medical community engages and understands. We're all going to benefit from the knowledge. We're all going to be able to grab some of it and interpret it, and perhaps it will contribute, I think it will contribute, to really the education, the knowledge base, the skills of the team itself. So it has tremendous potential. I'm really excited to be a part of it.